Portland wants to challenge the city's current needle exchange program.
The city's current policy gives out 100 needles in a single exchange, but the mayor says he will propose a resolution next month to decrease that number to a 1-to-1 ratio. That means a person will get the same number of syringes back as the number they trade in. News Center Maine's Sam Olsen spoke with the mayor today on why he hopes his resolution will start a conversation he says is long overdue.
We have needle waste everywhere. Some say it doesn't pose a threat, but I think it does.
Portland Mayor Mark Dion says needle waste is a problem of the city's own making. Mayor Dion says there are too many needles lying around our city, like this one just steps away from the sidewalk at Deering Oaks Park. City data shows staff distributed almost 786,000 new syringes to IV drug users over a one-year period from 2022 to 2023. And during that time, the city collected about 537,000 contaminated needles through the exchange program, meaning close to 250,000 are still out there somewhere.
So I'm saying we need to turn the faucet down. I don't want an environment where you have to step around needles as part of your daily routine.
Within the past year or so, the city cleared out multiple homeless encampments. Portland Police Department substance use disorder liaison says people left behind more than 80 gallons worth of syringes.
There are a lot of unintended consequences, and there needs to be some real thought about what's the best way forward.
He and other workers in the harm reduction community also recognize there are concerns with reducing the ratio in a needle exchange. Some are concerned people with addiction will reuse or share needles, which can increase the risk of blood-borne infections like HIV and hepatitis C.
When a person is in that need to get their drug or they're going to be really, really, really sick, things like worrying about Hep C or those kind of things are not the most urgent need for them.
Portland Recovery Community Center's Executive Director Leslie Clark says lowering the ratio in an exchange is a tough balancing act, considering both the safety of those who are in the throes of addiction and the rest of the public.
We have to meet people where they are. That phrase is used so often, but we have to meet people where they are and then help them incrementally get well.
Mayor Dion says he believes that's even more reason to reduce the number of needles given out at a time as a way to increase the number of times people will facilitate conversations about treatment options.
I want us to be more intentional about saying, hey, we're supplying you some needles to keep you safe, but you need to start considering that this won't last forever and you need to get into treatment.
In Portland, Sam Olsen, News Center, Maine.